Good day, this is Professor McClammy here today with you to discuss antivirals. So viral replication is about viruses they cannot replicate on their own. They must attach to and enter a host cell, and then it uses the host cell energy to synthesize protein, DNA, and RNA. This is an example of virus replication. Shows you the different chromosomes, the host nucleus, RNA, and the cell membrane. Viruses are difficult to kill because they live inside of the cells. Any drug that kills a virus may also kill other cells. Viral illnesses such as smallpox, sore throat, conjunctivitis, warts, influenza, respiratory infections, gastroenteritis, human immunodeficiency, which is HIV, AIDS, herpes, and hepatitis. Most viral illnesses are bothersome but survivable. Effective vaccines have prevented some viral illnesses, and effective drug therapy is available for a small number of viral infections. Antiviral drugs kill or suppress the virus by destroying virions or inhibiting the ability of viruses to replicate. Immunoglobulins are concentrated antibodies that can attack and destroy viruses. Viruses controlled by current antiviral therapy are CMV, hepatitis, herpes, HIV, influenza, and RSV. Characteristics of antiviral drugs are able to enter the cell infected with the virus. They interfere with the viral nucleic acid synthesis, regulation, or both, and some drugs interfere with the ability of the virus to bind to the cells. Some drugs stimulate the body's immune system. Most are opportunistic infections. They occur in immunocompromised patients, typically would not normally harm immunocompetent person, require long-term prophylaxis, and anti-effective drug therapy, can cause other viruses, fungi, bacteria, or protozoa. Antivirals are used to treat infections other than HIV and some by AIDS. So here's some other examples: hepatitis B, hepatitis C. Acyclovir specifically is indicated for herpes simplex, varicella, and zoster. It inhibits the DNA polymerase, incorporates into the viral DNA. Contraindications and adverse effects. There are many drug interactions. You need to be aware of those. Routes and dosages, oral and IV. This goes over the mechanism of action and uses for non-HIV viral infections. Acyclovir is also known as Zovirax. Tamiflu is another common used antiviral drug for influenza type A and B. It reduces the duration of illness. Common side effect, nausea and vomiting. It does not cure the illness. It just may decrease the duration with a couple of days, and like I said, also decrease severity of the symptoms. There are many adverse effects, so sometimes you have to weigh out the benefit versus the risk of giving these medications. New cases of HIV have decreased by 33% since 2001. There are retroviruses available, transmitted. HIV is transmitted by sexual activity, IV use, perinatally from mother to child. Here's the timeline and spectrum of HIV. And there are 4 stages of HIV infection, so be familiar with these. And as you know, many of you have already gone through the HIV module, which will go into this in a little bit more depth. This talks about opportunistic infections, antiviral drugs, continued, and nursing implications.